My name is Dr. Ashwini and I'm here to answer your question. So, the first question, how do we manage a breast lesion? So firstly, we can divide a breast lump into benign, which is not harmful, or cancerous, also known as malignancy. But today, what I'm going to talk to you about is how to detect some of the warning signs, or also known as red flags, that could indicate that this breast lump is dangerous. Number 1, a breast lump that is growing very rapidly, that it changes the size or shape of your breast. Secondly, if you have an inverted nipple or unusual discharge from the nipple, which includes blood. Number 3, persistent breast pain or breast lump that is not related to your menstrual cycle, especially seen in younger women. And lastly, any skin changes around that particular breast. So we all know that sometimes cancer is contributed by risk factors that are out of our control, such as strong family history of cancer. But what we can do is to take steps to detect these breast lumps early before the cancer can spread. It is said that 40% of diagnosed breast cancer is actually detected by women who actually felt a lump. So, what we should be doing is our monthly self-breast examination, as well as for women aged more than 40 and above, routine mammogram is advised as per recommended by National Cancer Society of Malaysia. And lastly, if you have any doubts or you are experiencing any of the signs and symptoms that I mentioned earlier, please do not hesitate, but go and visit your nearest doctor for consultation. The next question I would like to address is, how do you know if someone is dehydrated? So dehydration basically occurs when you use or lose more fluids than what you take in. In other words, you are not drinking enough or having ongoing losses such as vomiting and diarrhea. Dehydration can happen to anyone at all, but it is especially dangerous when it involves young children and elderly population. So, coming back to our question, how do we know if someone is dehydrated? Some of the signs and symptoms of dehydration in adult includes complaint of extreme thirst, reduced frequency in urination with concentrated urine, dry skin, tiredness, and dizziness, just to name a few. Whereas in children, you can tell a child is dehydrated by looking at their dry tongue and mouth. And also, they will usually have reduced urine output with sunken eyes, with very little or no tears being produced when they cry. So how do we prevent dehydration is very simple. Drink plenty of fluids and consume food which is high in water content, such as fruits. And lastly, just a reminder, especially when you are unwell, try to take in more fluids than usual to stay hydrated. That's all from me. Thank you. Stay safe.